The other major news tonight involves those vaccinations in this country. At least 2 sites tonight temporarily halted in North Carolina out of an abundance of caution amid concerns that a small number of patients have reported adverse reactions to the Johnson & Johnson vaccine. And it comes just one day after similar concerns at a site in Colorado, also temporarily shutting down. So Dr. Jha is here tonight, standing by. We're going to ask him, is there reason to be concerned here? But first, Whit Johnson on the virus, the halt at those sites, and the newest concerns over the numbers tonight.
Tonight, at least 2 vaccination sites in North Carolina pausing operations after some people reported adverse reactions to the Johnson & Johnson vaccine. From UNC at Chapel Hill to PNC Arena in Raleigh, officials saying the move was out of an abundance of caution. It comes just a day after 11 people at this site in Colorado of the 1,700 vaccinated yesterday suffered adverse reactions like dizziness and nausea. That location closing, the governor trying to reassure the public.
A couple people, had some orange juice afterwards. Maybe they were scared of needles, whatever it was, but no issue with the vaccine.
Tonight, Johnson & Johnson saying in a statement, we carefully review reports of adverse events. We are collecting the necessary information to assess these reports. And the rollout of the J&J vaccine hitting another hurdle as states brace for a nearly 85% drop in doses from about 5 million doses this week to 785,000 next week.
There are available appointments now. They're probably not going to be available next week.
The governor of Illinois blaming the latest drop on that mix-up of ingredients at a Baltimore plant that potentially ruined millions of doses that had not yet been sent out.
15 million doses would have been distributed over some time to the states, and those are lost.
But federal officials insisting distribution was always uneven, and they still expect J&J to meet its goal of 100 million doses by the end of May. This as doctors warn of a new phase in the pandemic, impacting the young and unvaccinated.
Young kids, particularly those 8th grade and younger, really are spreading this virus like we haven't seen before.
In Massachusetts, 14-year-old Carissa Duncan just spent 6 days in the ICU with COVID and that rare inflammatory syndrome.
I was having trouble breathing and I had a really high temperature and my face was really reddened.
Carissa now working to regain her strength.
And David, the CDC director says she's worried about kids, but also adults in their 30s and 40s, many still unvaccinated, and more of them ending up in hospitals with severe disease.